What's up, Smarties? Welcome back to the channel. My name is Aggie if you're new here. I'm gonna answer the elephant in the room question. Do I miss being a labor and delivery nurse? Yeah, let's get into it. Now, if you're new here, I am a new dermatology nurse practitioner. Before working as an NP though, I was a labor and delivery nurse for 4.5 years. So a good amount of time. I had a staff job for a good chunk of that period, and then I went on to do travel nursing. If you know anything about my nursing journey, I at one point thought I was going to be catching babies down the road as a midwife. I clearly pivoted and took on another role as a dermatology nurse practitioner. But I just want to be real with you guys and talk about whether I am missing being an L&D nurse. If you haven't already, please subscribe and let's get into it. Let me tell you guys what I do miss about being a labor and delivery nurse. I really miss empowering women as they would push their baby out. I miss that feeling of just being proud of my patients who worked so hard up until that point. You know, some pregnancies can be extremely challenging mentally and physically, and then just the whole childbirth experience, the whole laboring experience can be very draining and an emotional roller coaster. So I miss just that feeling of being so proud of my patients for just being strong through it all, or trying to be as strong as they can, and he's working hard to deliver a healthy baby. And I miss seeing those strong partnerships, whether it was their spouse, their boyfriend, their family member, a good friend, just helping them to get through that experience of laboring and delivering a baby. I just love seeing those strong partnerships because it always inspired me for whenever I have kids down the road. I want to make sure I'm surrounded by people who support me, uplift me, and I loved being able as the nurse to coach both the patient and their support team on how we could together work to have a healthy and safe delivery of a child. So I really do miss those special moments. Childbirth is such a unique and miraculous time, and I was always honored to be a part of that for patients. So I do miss it. I'm not gonna lie, I do miss that aspect of it. Just like I said, just being a part of that journey. And of course I miss seeing the childbirth itself. I used to always, it was like a very euphoric feeling, just that moment the baby's coming out. It was a thrill that was so incredible, and I do miss that. Even as my friends are starting to have their own kids, like, I ask for all the details of their birth experience, and I wish I was there with them to be a part of it, because it's just so special. And the reason why I chose L&D to begin with is the same reason why I miss it to this day. However, heavy on the however, there are aspects that I do not miss. And let's get into those as well, because I think y'all need to hear both sides. So I do not miss being stressed and burnt out from nursing and being a labor and delivery nurse specifically. Now, I will say labor and delivery, I think, is often glamorized, especially as a nurse specialty, but it is a high acuity area. And as much excitement and as much of a thrill that's involved, that's exactly what can make it stressful at times. You know, managing very sick patients and working at very high volume hospitals. I do not miss the stress that came with that at all. Like, I also do not miss feeling like just a number at times, you know, like feeling like I did not have my bases covered, feeling like I was being underpaid for the work I was putting in. and underappreciated. I don't miss that either. Feeling like some of my colleagues at other facilities perhaps maybe working less and getting paid more. I did not like that idea of not being compensated fairly. Like I said, for my experience and what value I brought to the hospitals. So I don't miss that at all either. And that's me being very honest and transparent with you guys. These are things that people won't share on a platform like this, but let's keep it 100. Nurses across the board often are underappreciated, underpaid, and we got to talk about it. Let's talk about it, what we can do to address that issue, because nurses are needed. It's such a rewarding field to be in. I went on to do travel nursing, which was very lucrative, and I really enjoy it. I have a whole series where I talk about my travel nursing journey. I will link that down below. I have vlogs, I have tips, and as much as I love travel nursing and as much as I think people should take advantage of it, towards the end I was becoming over traveling and just the instability that came with it. And so we have to take advantage of our resources as nurses. So this is when Incredible Health comes into the picture. It is a free resource, you guys, that connects nurses to hospitals and gives you many options for places to work that is perfect for your location and for your specialty area. So not only is it connects you with these interviews and allows you the autonomy to choose where you work, but it is a platform that has so many resources. One of which I love is the ability to see what nurses are getting paid in your area. So you have an idea of what you should be compensated, and you'll be able to have realistic expectations when it comes to interviewing and comparing contracts and negotiating. Also, they have an amazing community where you're able to dialogue with other nurses about hot topics in nursing, maybe an issue you're coming across, asking people for their insight and their perspective on certain topics. So community is so important, not just in nursing, but in whatever career you're in, just to feel like you have a place to go where you can ask anything and it be answered by other diverse professionals in your area. And then I also love that they have a mental health portion of their website where, guys, can we just talk about the fact that we need to stop waiting until we are burnt out to prioritize our mental health. We need to maintain our mental health. So whether that is having your regular self-care days, having your regular practices of journaling, or just doing hobbies that you love to decompress, or just having mental check-ins. I love that they have this aspect on their profile so you can always check in with your mental health, so we do not get to the point where we are burnt out and we have nothing to give to our patients. So thank you, Incredible Health, for sponsoring this video. I highly encourage you guys to click the link down below, sign up. It is completely free of charge, and I really feel like this resource would have helped me in my career as a registered nurse, and even now it's for NPs as well. It's something that I have joined and I'm a part of, taking advantage of the resources, and we just have to take advantage of these tools so we can be better at our job and that we can really enjoy our job. Because for most of us, we went to nursing because of the fact that we wanted to help other people. We wanted to be hands-on. We wanted that reward that comes with the field, but oftentimes we do get burnt out. Taking advantage of these free resources can definitely keep us from that. So those are the things that I miss and don't miss about being a labor and delivery nurse. I hope this gives you some insight and perspective from a former registered nurse, now NP. And most importantly, I hope that it gives you some encouragement and some tools to be happier in your careers moving forward. I will see you guys on the next video. Please comment, like, and subscribe. Also share, and I'll see you guys on the next one.